Hello, everyone, and welcome to Diabetes Hope Foundation's morning session, Transition 101. Relax, kick back with your beverage of choice, and we hope you enjoy this morning's lineup. And please don't forget to join our chat. We look forward to hearing from you and all your experiences on this very challenging and exciting topic. My name is Barbara Pasternak, founder and chair of Diabetes Hope Foundation and mother of two now adults with T1D. Today, we'll be discussing type 1 diabetes transitioning towards their independence, which includes moving into adult care from pediatric and post-secondary education from high school. I hope you will find your silver lining in our discussions through the information and resources that you will hopefully take away to help you and your families with their personal journeys. The conversations this morning will be from the perspective of parents with teens who are recently transitioned this year, very unique and challenging times as they continue to deal with the stresses of COVID in the university classrooms. Also from our clinicians who will be bringing different views on transition from virtual care to research. And from our alumni, who will be discussing their lived experience as they move through their various phases of their transition. Our objective today is to provide you with resources, accessibility information, peer academic, and social support to assist you in navigating through your early months of transition on campus and beyond, especially since COVID is still part of our lives. As we are all finding, transition is not a single event. It is truly the largest milestone in the lives of our youth. A successful transition requires information, confidence, socialization, and support. As we are moving into the 2021 school year and as it approaches, university and college students with diabetes and their families are trying to figure out how to safely navigate returning to academics the time of COVID, and how effective virtual visits are in preparing our youth for the next steps. Teen transitioning from youth to young adults is a challenge for both teens and parents. Young adults want to take over the responsibility for the diabetes from their parents, but they need knowledge, experience, and skills to succeed. Parenting through this pandemic definitely has its moments, but to the young adult with diabetes, it's certainly an additional stress for both parent and child. I just want to take you back, or think back when you were younger, to the time when your actions were based on impulses instead of information. Over the years, you've made a lot of choices, and as a result, learned a lot of lessons, some of them pretty painful. Now, adults, all those lessons you learned allowed you to make good choices and has allowed you to gain independence. So the teen years can be confusing, as we all know, but for kids with diabetes, the challenges can be even greater. Okay, Rav, it's your turn.
Hi, good morning, everyone. My name is Samra, Rav like extravagant, and I am the program director with VHS. I was diagnosed with type 1 when I was 2 years old, and I'm the only person in my very big family who has ever had T1D, which did, pose a lot of challenges growing up and even now as an adult. There are a lot of mixed messages and stigma around diabetes, and I have made it my personal mission to challenge these messages and switch up the narrative. In 2013, I was very, very lucky, and I received a scholarship from DHS. And I'm incredibly grateful for all of the folks with diabetes I've met since then. Because again, growing up, I didn't know anybody who had it. So it was really nice and comforting to just be in a room of people where pumps were beeping and it was totally normal. I wanted to say thank you all for joining us this morning. I hope you have a cup of coffee, some tea, a croissant, as we discuss all things transition. And speaking of receiving my scholarship in 2013, that is when and where I met our next amazing moderator, Clara.
Hi, everybody. My name is Clara Tyson, and I'm a program assistant with the DHS. I was diagnosed with diabetes when I was 13, so well over 10 years ago. And like Rav, I was the only one in my entire family with diabetes. So when I was diagnosed, it was a learning curve, not only for me, but also for my entire family. And from when the time I was diagnosed at 13 until age 17, I had never met another diabetic. And I was becoming convinced that I may have been the only one in the entire city of Toronto. But then in 2013, I received a scholarship from the DHF, and I met an entire community of type 1 diabetics who were going through the same experiences as me at the exact same time. And like Rav said, this is where we actually got to meet each other. Over the years, I've gained so much from the DHF community, and I've also been able to give back. So thank you for joining us this morning. I hope that you'll learn a lot and that you'll also want to be part of this wonderful community as well.
Okay, so here are some of our programs. So firstly, we have our Youth in Transition, virtual workshops, and resource guide. So think about each year in January, there are so many students who are in their final year of high school, and they're ready to begin, planning to move out, what courses they're going to take, residence, like what type of room do I want? And so we are here to prepare them for this transition, especially as they move to a more self-directed adult diabetes care regimen. Our pre-transition workshops for teens, parents, healthcare professionals, and alumni volunteer mentors are here to discuss transition. Now, DHF has created this Canadian Guide for a Successful Transition to College and University, which offers students information regarding their rights and accessibility options at post-secondary institutions across Canada. Now, we'll touch upon the resource guide in the next slide, but it is an incredibly resourceful tool to just help folks who have diabetes realize, hey, like I can receive accommodations at school. And a lot of alumni input went into the resource guide and all the other programs, and we really couldn't have done it without their tips, tricks, and insights. Secondly, we have the Scholarship and Mentorship Program. Now, the Hope Scholarship Program highlights the personal triumphs of young adults who face the many responsibilities associated with diabetes management. Our mentorship program matches new recipients with a mentor from the DHF family to provide a continuum of support before, during, and after their transition and through their first years of post-secondary. Then we have our peer support program, which is also like our T1D buddy program, where we provide that social and emotional support for type 1 teens ages 13 to 18. Our T1D buddies have all transitioned to adult care. They've been through post-secondary, and they want to support younger teens as they prepare to make their transition. And one last thing I want to touch upon is our Wellness Wednesday webinars. Because of COVID, we have to move our in-person events online, and we have been able to reach such an amazing group of folks through our webinars. We reached over 35,000 people. Our topics have ranged from diabetes management, how to deal with COVID, mental health. We've even had alumni come back and talk about their experiences as frontline workers and how to be advocates for their diabetes and for themselves. So it's a lot of great messages to share, and you can still see those webinars on our Facebook page, our YouTube channel, and on our website. And lastly, I did just want to mention that these programs were created through the input of alumni and the needs clinicians have highlighted for their patients. So without the support of our alumni and the parents and the clinicians, DHF would look a lot different. So we're incredibly grateful for all of their support.
Okay, so the resource guide, Rav mentioned this. This resource guide is something you're going to be hearing a lot about this morning. It is recommended by the Ministry of Health's Ontario Pediatric Diabetes Network, and the guide provides secondary students with information about their rights and benefits, as well as accessibility options as a student with diabetes. The guide assists them in finding the closest diabetes and accessibility programs and includes tips and insights from the Foundation's own alumni to assist them in their transition to post-secondary education and adult diabetes care. A total of 191 accredited Canadian colleges and universities were reviewed and published in one single comprehensive 300-page guide. And the best part is that it is completely free to download on the DHF website. So I really recommend that you guys take a look if you're transitioning into post-secondary, or even if you're not, maybe you're halfway through and it's still a really useful guide.
So here are some of the benefits of being a student with diabetes. If you want extra time for tests, or you want to bring a snack with you to an exam, or you want to request a specific room at residence, you can do it. I know it's a little bit awkward to kind of like put yourself out there and, you know, talk to these services, but they're here for you. And it's an amazing opportunity. I do encourage everyone to take advantage of it. So check out the transition guide for more information about the accessibility services for schools you want to check out or attend. And I'll be sure to include a link to the transition guide in both the Zoom chat and on Facebook. And just as a personal note, in the earlier stages of the transition guide, I actually used it when I went to the University of Ottawa. I had a lot of issues with my insulin pump, and I was like, oh, my healthcare team's back in Burlington. Where do I go? So, you know, with that early stage of the transition guide, I was able to locate like the nearest endo clinic to me, the pharmacy on campus. So it's really come a long way, and it's a super valuable tool.
So we're moving into our special guests, and we'd like to welcome Jess, Brittany, and Amanda, and they will introduce themselves. So let's start with Jess.
Hi, everybody. My name is Jess Forster, and I have worked in the Pediatric Diabetes Clinic at Markham Stouffville Hospital for the last 14 years. In addition to providing a professional role, I have enjoyed meeting and working with people diagnosed with type 1. I also have a few people in my family who I know and love are also diagnosed with type 1. So I'm so happy to be here. DHF has always been a huge resource for us in clinic, and I'm happy to be a part of today's discussion.
Amanda, welcome.
Hi, everyone. Thanks, Barbara. My name's Amanda. I'm a 2010 scholarship recipient, and I've done a number of the Diabetes Hope Foundation events over the years, and it personally really helped me in my own transitions throughout, multiple stages of life. I am a registered nurse, and I've done a variety of things with that involve diabetes. I've worked as the nursing coordinator with Camp Huronda, and then I did a couple of years on the floor as a nurse, but diabetes found me again, and now I'm a clinical diabetes specialist with Tandem Diabetes.
Thank you, ladies, for sharing your wonderful information. I think, Clara, are we going on to the next question?
Yes, we are. So to start off the panel, here we have some common themes and topics that come up maybe when we're talking with our clinicians. And so the first question for our clinicians today is about virtual appointments. So when COVID hit, many aspects of our lives went virtual. Almost every aspect of our lives went virtual, and this includes many of our doctor's appointments. As clinicians, are you guys finding that many youth are not keeping their virtual appointments? And are you doing anything different in this virtual world to ensure that youth stay on track with their diabetes management? So we can start with Jess.
So as the social worker on the team, we have moved obviously to most, about 90% virtual appointments. When COVID hit initially last March, we went completely virtual, which was a change of pace, I think, for everyone. And we have been slowly trying to figure out this virtual landscape. We do see patients. 25% of our patients do come into the hospital and have to go through obvious screening measures, but we are trying to provide more online support. And what do I mean by that? So our patients see their endocrinologist for essentially 20 minutes over Zoom or over OTN. And that is not a lot of time to deal with everything that you have on the screen here. Self-care, burnout, physical activity. And so we are trying to encourage our families to not only upload their information, especially if they are technology-based, so whether that's on a pump, on a meter that is connected to some sort of virtual program. We are trying to prepare for the visit beforehand, see them, and then we deal the allied health. So myself, dietitians, nurses, we try to reach out for support as needed. So my number of virtual appointments that I do after school, my 3:15, 4:15, 5:15 appointments are fully booked. And then specifically for those transitioning youth, we are also providing webinars. We know that we are not providing the same information as we would in clinic. And so we are targeting the people who are born, in a specific year, who are transitioning in September. We are actively targeting them and providing webinars to give this kind of information. It's not just a one-time thing. We've started in February. We're having more virtual webinars in July and August, really to remind families of the issues that you face. But it is a challenge. It was a challenge in person. It's a challenge virtually, but we want to do the best for our families and for our patients.
Thanks, Jess. Those webinars, I'm sure, are really, really valued and really useful. Brittany, how about you?
Yeah, so with my last position as a research coordinator there, we didn't have to deal with people going through transition very often. And in my position now, I've heard a lot of positive feedback with virtual visits in, the uploading of information and people getting that ahead of time, like the healthcare providers getting that ahead of time, so that when they do meet with the transitioning population, the visits are quite productive. So that's a positive that I've heard. But otherwise, I don't have a lot of firsthand experience as a nurse working with those in transition.
Amanda, how about you?
Yeah, so right now, one of my big roles in my job is doing training on the tandem pump and, helping people who may be struggling. And what's been a positive out of the virtual, I know that, pros and cons to everything. Of course, I miss being face-to-face with everyone, but it has opened up a lot of opportunities that I think could, reflect into how we can assist youth who are transitioning. So for example, if I have somebody reach out and they'd like to try a new infusion set, I never would have thought before that I'll jump on a video call and walk them through step by step how to do it. And so I think if you're looking at transitioning to a school, across the country, and there's a lot of hesitation to that, and you have to go to your first diabetes appointment alone, I think that opportunity to be able to open up the fact that, you could have your guardian video call into that very first diabetes appointment. And so I think that what we've seen in the virtual sense is that people have responded quite well to it. I think better than we all thought that it would go. And so we've seen a lot of positives come out from the virtual component. And I think the big one that I've personally found is just more access to resources, where sometimes we'd have to wait to train an individual until they're back on their reading week from university or in the summertime, and all this rush to do these things when they're back home, where now we have that opportunity to kind of help them with that transition by just jumping onto a video call and semi-face-to-face helping them.
I think a silver lining of everything moving virtual is definitely the increased accessibility. It's definitely a positive, and it's something that I hope doesn't go away when the pandemic is over and done with. Rav, I think you have the next question for our lovely clinicians.
Yeah, for sure. Speaking of being in the virtual world, it's great that we're accessible and we can reach each other. But kind of a downside of the virtual world is that it can be kind of isolating, and kind of how Amanda touched on. We do miss that face-to-face human personal interaction. And I know for me, when it comes to mental health, personally, my diabetes clinic hasn't really helped me if I needed support, which is okay, because I have been a personal advocate for pushing to find resources that work for me. And currently, most transition and mental health services are hospital and institution-based to provide support for youth with diabetes. How are you supporting our youth to address their fears and anxieties by the pandemic and its impacts on diabetes distress? So let's start with Brittany.
Yeah, so I can speak to, I'm working on my Master of Nursing right now, and my focus is on transition of care. So I can speak to what I've read in the research. Again, I don't have quite that personal experience yet. I'm sure that'll come, like Amanda said, in the month, but I'm still getting into my new job. So it's a huge component of successful transition is having peer support, and like someone that you can chat to about these things if your healthcare team is not as accessible to you, or maybe people aren't comfortable having those discussions in a virtual environment or a phone call. You know, that's something that's really intimate, and they may not feel comfortable with that. So having that peer support is huge and really tends to positive outcomes in transition. Just to complain about stuff or ask questions, you know, try to find someone, you know, in their university or college that maybe also has type 1. All these things will really help with mental health for sure.
Yeah, that peer support piece is really important. And I know our alumni will talk about our mentorship program and their experiences with that, but that is available and we'll touch upon that in a little bit. So Amanda, you next.
Yeah, so I think one of the big things, you know, with diabetes burnout and that added layer now with everyone going through, you know, the struggles of what COVID has brought, it's kind of finding creative ways to deal with these struggles that, you know, before we could reach out, you know, hang out with some friends, the community that way. But I think that the virtual world has, again, opened up a lot of opportunities for individuals to join communities. And so having this big online, you know, accessibility across the board to kind of let people know that they're not isolated, because I think that's the biggest struggle is that, you know, when you're feeling stressed about sometimes, just knowing that somebody else feels a similar way sometimes relieves a big part of that burden, because you're not thinking that, you know, why am I feeling like this? Why am I tired of having diabetes? So if you just kind of throw that thought out into the world, I'm tired of having diabetes, I'm feeling burnt out. And when you hear everyone else kind of echoing that sentiment and then through that offering their tips and tricks. So I think that, you know, it's finding these creative ways to connect with people and build that support, because we are going through, you know, everyone's got their own story with it, but all very similar positions to it.
Yeah, for sure. Especially with us even doing these webinars and like our pre-webinar meetings, it's so nice to just like talk about it. And there's even a lot of great like Instagram accounts that I've like followed recently about who have diabetes. And I'm like, this is great. And it's been such a good way to kind of avoid feeling so isolated. So Jess, what about you?
So I loved what Amanda said is, you know, finding your community, finding your supports, finding your resources, and being able to vent, sort of like what Brittany said. And the important thing to remember in this unique time period is that we are not alone. We are not alone in the struggles that we have. You know, there's this extra layer of challenge when you put a chronic condition on top of this. And what we've done specifically at the hospital is not only offer webinars around mental health, but also remind people of the resources that are out there. So part of my job is to connect people to community and you know, give them a certain number of options that they can access. And certainly the DHF peer-to-peer support program is one that we often mention. We also talk about Good to Talk, which is, or Kids Help Phone, which people can text or transition. There are WhatsApp walk-in clinics, as well as whether you are you know, in a school accessing guidance support, or, you know, post-secondary and accessing campus mental health services. The important thing that we like to talk about and to remind people is that do not wait. If you are starting to feel that downward, like I can't get out of this rut, this feeling, this stress, this burnout, it is incredibly courageous and actually very, very strong to say, hey, this is not working for me. And I need somebody to rely on. And so building in those support systems are just so incredibly important. So please, please, please do not wait. In terms of my clinic, I am, you know, always available to chat to people, and I would be happy to, you know, help unload those thoughts, feelings, fears, stress, burden, sadness, the grief of what it's like to live through this global pandemic. So if you don't take anything away from what I've just said, please just remember this. Please do not wait, and please ask for help.
For sure, and it does take time to kind of get comfortable asking for help, but you know, one small step forward and, you know, things can change for the better. So thank you, Jess, for all, like, I would love to have you in my clinic. You're awesome.
That's very powerful, ladies, and especially when we talk about mental health, it is so important that everyone knows where to go and who to speak to, because we are all living in very unusual times where, you know, our human nature is not used to this. We're used to touching and feeling and hugging and seeing and being part of. So for sure, your information, Jess, and all of those on the panel were very impactful, and there will be some resources that we will be including at the end of this webinar, so look for those particular resources. Before we get into the COVID question, I want everyone, our audience, to look at all of these areas that we have logged from speaking to several alumni. And these were the issues that were actually very prevalent in their first and second year university. So if any of you out there want more discussion on it, please give us a chat and we'll further discuss it, because we're just moving into the next question, in that what does COVID and post-secondary school look like to our panelists as they're transitioning? So we'll start with Jess.
So COVID, I mean, if anybody has a crystal ball and can read the future, that would be great. I don't know what COVID and post-secondary school looks like, but what I would suggest in terms of you know, now that you have this opportunity, now that we're in a series of, you know, partial lockdowns, you know, we have time to practice our transition skills, right? I think as clinics, we are trying to get better at communicating what transition looks like. And as we have, certainly in my own experience as the social worker on the team, I think the understanding of what it looks like, what transition looks like in terms of COVID, I think we're getting a better sense that it's probably going to be virtual, it's probably going to be online. But what we always recommend, you know, whether you're going in person or via classroom, is trying, you know, these different transition activities. So do you know the names of your medications? Do you know where you can get your insulin? You know, sometimes the insulin fairy just doesn't arrive and put the insulin in the fridge. You know, you have to go to the pharmacy and actually order it. You know, from now until next September, you know, having your young adult practice, talking to the pharmacist, even ordering the supplies, knowing where they're going to get the money from. You know, is that going to be a post-secondary, you know, is your tuition going to cover it, or is your family plan going to cover this? There are so many things that that you can practice from now till then.
Amanda, your thoughts?
So I think, again, you know, with COVID, we've had to adapt. And one of the nice things with diabetes, and one of my roles with the Diabetes Hope Foundation is with the scholarship committee and reading all those. And, you know, the biggest theme is that, you know, we can adapt with diabetes. We've become very good at that. And so kind of applying those skills to the fact that with COVID, you know, those expectations that we had for what transition will look like in these new experiences going off to that next step after high school are going to be very different. And so, you know, Jess spoke to that about, you know, you're allowed to feel that grief for those changes and kind of that loss of this isn't what it was supposed to be like. And so being able to, again, just reiterate, reaching out, finding that community, hearing that other people are feeling that way, and just recognizing that, you know, not everything has to have changed. You can still work towards building that independence in your transition, even if that means that you haven't left, you know, your parents' house. Maybe you're still in that same location, but you can still be working through different things that transition could mean to you and what you want from your independence kind of moving forward. And so it's, you know, you don't need to cut ties and transition and become independent on day one by any means, but just looking at, you know, what are some of the goals that I can now change? What would I like to achieve in this kind of new transition that's here? So I think really it's the openness to adapting and maybe just reworking some of those kind of visions that you had for yourself transitioning to that next step.
That's great advice, Amanda. And basically what you're saying is taking baby steps, not really changing what you're doing, but just taking baby steps to move to the next level. Brittany, what are your thoughts or advice for parents and kids?
Yeah, I'm kind of echoing what Jess and Amanda have already said, but I guess a positive of the fact that a lot of education will be virtual is we now will have a safe environment to gain independence without being fully like away from their safe space. So, like as Jess mentioned, like getting prescriptions on their own, increasing this sort of independence, but they're still home. So if they did forget, mom and dad are there to help out, but just starting to, get those sorts of thoughts going in their heads is really important. So, and hopefully next year when we can actually go back in person to things, they are already like really comfortable with those basic things, because you're going to need to know how to do those things as an adult. That's just the reality. So if you're able to do that in a safe environment of your home slowly, then I think that's really impactful and could be a really big positive actually out of all this. And then also like the peer support and getting involved with things at your school, outside of diabetes even, because that gives you a chance to learn about new people. Maybe they can learn about you and learn about diabetes, which is always great to educate others about type 1. And I think that's just a really great experience too, that could be had.
Thank you, Brittany. That's wonderful information. And ladies, thank you for your very valuable insights and for sharing it and being so articulate in your points. We really appreciate it. Now we like to welcome our lovely parent panel, Vicki Firth and Michelle Stanford. So let's start with Vicki. Just give us a brief introduction.
All right. My name is Vicki, and I have a daughter who's 19. She was diagnosed at 8 with type 1 diabetes, and she is currently in her first year of university.
Thank you. Michelle.
Good morning. My name is Michelle Stanford. I have 3 children, but one of them is a T1 diabetic. Her name is Natasha. She's in first year at Queen's, and she was diagnosed when she was 14.
Terrific. Thank you.
Yeah, honestly, like my mom was the one who knew that something was wrong with me when I got diagnosed. So shout out to all the moms who just know and have that gut feeling and support their kids. So I really do appreciate all the moms out there. I think we all know that it's common for there to be some kind of challenge when we're raising adolescents. Under most circumstances, both the parent and the child work towards increased child autonomy and independence. Now, when a child grows up, they develop relationships and receive support from others, and that kind of leads the parent to adapt because now their role is changing in their child's life. And now for parents who have youth with diabetes, these normal developmental issues have an extra layer of complexity to them. Critical short and long-term health and safety implications are directly associated with the child's lifestyle and diabetes management. Now, parents may feel confused and unsure about how much responsibility to hold on to during their child's transition. However, studies have shown that support from parents has been linked with better adherence in youth with chronic illnesses. So how did you assist your child with their transition to ensure that they were ready to manage, diabetes management on their own? Let's start with you, Michelle.
I think the key, and I know that Vicki and I have very similar experiences, or at least approaches to our children. We started with Natasha, first of all, very subtly, right? It wasn't like we all of a sudden said, okay, like you're responsible now. We started with really 3 areas for her to begin to show herself, and then us, that she could manage things on her own. And some of it's already been talked to, right? So first of all, ownership and responsibility of what you need, right? So starting to, how does she access the medication supply? Who does she call? Does she have the contact in her phone, et cetera, et cetera? Scheduling her own appointments, right? It used to be me that scheduled her and told her when to go. Now she schedules me and sends me an invite. And then the other piece she had already done really well at because she was in high school, but it was her having to learn again how to have those self-advocacy conversations, right? So teaching her roommates and or her new teammates, right, about the signs and symptoms, low blood sugar, emergency plan, where the glucagon is, and then sort of a renewed focus on her own readings, right? So that self-advocacy says I need to be able to tell people what I want, and then I also be able to really need to know what I need to know in terms of the data. And then, you know, lastly is about preparedness, which I'm sure Vicki will talk about when it comes to, you know, we actually made her get a, we didn't make her do much, but we did make her get a new visible medical alert bracelet, because she was going into a whole new environment where people didn't know her, as opposed to, you know, we had the backpack and the glucagon patch and things like that. So it was almost like we had to restart everything we did in grade 9. But this time, Mom wasn't in charge. She was in charge, and I was like her assistant coach.
Yeah, you have to be like her cheerleader, and I'm sure Natasha is adapting really well. Especially that self-advocacy piece is so important. It's such a uncomfortable thing to do at first, but you just get the hang of it. And so I really do appreciate all that you did for Natasha. How about you, Vicki?
Similar to what Michelle did with her daughter, we started preparing our daughter early on in order to manage her own diabetes, slowly giving her ownership of the different tasks that need to be done. We knew that she was more than likely going to go away for school. So I think as early as grade 11, we started shifting some of the responsibilities over to her so that she'd be prepared and that we'd be confident that she would be okay on her own. I think that's a really, you don't only want your child to be confident and comfortable, but it's also helpful for yourself to be. As parents, we are often, you know, always going to be a little bit on edge, but it's an added comfort to know that, or have confidence in your child. We did things like she would have to order her own supplies. She had an issue with her pump one time, and I said, okay, fine, I'll sit here with you, but you're calling tech support and figuring it out. And yeah, just basically getting her 100% prepared to deal with these things on her own. Now, one thing I found, though, that we learned this year is, as parents, we still need to be prepared as well. Our daughter had an issue where she'd been home for the Christmas break. She'd gone back to school. She'd put her insulin in her mini fridge in her dorm room. She'd put some cream in there for her morning coffee. She woke up the next morning and the cream was frozen solid. So it was iffy as to whether the insulin was okay or not. And she could easily go to a pharmacy in the community where she's living for school. She's only an hour away from home. So we hadn't actually moved any of her prescriptions or anything over. But we thought, wow, what if this happens at midnight? What if there's an issue with supplies or something? We should still have a stock at home, because we had actually sent everything off with her. So that was sort of a learning curve for us, because yes, again, there are resources where she's living, but if it's 1 a.m., I would rather, because she's only an hour away, hop in the car and deliver something rather than have her Ubering around her city trying to find available resource. But that's something that, particularly if your child's going further away, you might want to look into all the eventualities, all the issues that could arise, and sort of make a plan in advance just in case that happens, so nobody's panicking in the middle of the night.
Yeah, that's such an important thing to highlight, is especially if you're moving far away. Because at first I moved 5 hours away and I was like, I got this, I'm prepared. Turns out I wasn't. So I had to kind of on the spot just be like, okay, where do I go? Look at the transition guide. I'm like, okay, cool. So it's really, honestly, I support that, you know, you have that backup for Alyssa, because it kind of keeps you comfortable and at peace of mind. So I do really respect that.
From your perspective of parents, what's the greatest challenge for your child during this current transition? I just want to add that both of your daughters were guinea pigs this year. One of them went to university, went to the dorm, the other one came back or is living at home. So they had to sort of navigate together collectively with you and your family. They had to figure out by themselves, because this has never been done before. So this is an interesting question because they've already walked the walk.
Yeah, and it's a relevant issue right now, you know, in my perspective, given that it's highly unlikely that this year's graduating class, the class of 2021, will be able to go into full-on like residence, right? So our position, Natasha was accepted into residence at Queen's, and then when they separated, when they said only 50% of people can go into residence, we said to her, you're not going. You're not going because we don't know about this illness, and we do know that type 1 diabetics are at higher risk. So given that university is, kind of crazy to begin with, we thought that would be too much risk for her, right? So the risk of getting sick with COVID, while also obviously, managing, a potential complication. So we said to her, don't go. And then it turns out she applied anyway, and she got in, and then we refused to let her go to restrict, to short-term residents. But then what we said to her was, why don't you get an off-campus accommodation with 3 or 4 other people that is safer for you, it's safer for them. And so that's what they did. She plays field hockey for Queens, so some of the first-year students got their own place. And the challenge, I think, with, certainly Vicki's daughter has had diabetes since 8. Natasha's had it since 14. They've had a massive amount of transition to deal with, and their, hour-to-hour, day-to-day is complicated. But this is the first time that their disease puts them at risk for something else. So I noticed that a lot of the same why me frustrations that came up when she was first diagnosed came back up again, until Natasha got really adamant about people doing the right thing to stay safe with COVID, right? So high risk behavior, teenagers, you don't feel like you're at that great risk. And she, ended up finally kind of coming around, realizing that she needed to follow the social distancing, masking, hand washing, really, and make sure she still does it. She won't let other people who are behaving high risk come into their house. So the advocacy skills came into play way more during this period.
Vicki, would you like to share your advice?
The way COVID affected us initially was when Alice was in grade 12, she had planned a couple trips independently, which would have been the first time she'd been away from home for an extended period of time, aside from going to Camp Huronda, where she would have had to manage her diabetes 100% on her own. Because of COVID, those trips got canceled, so going to university was really the first time she was going to be on her own for an extended period of time. She did opt to go into residence. She didn't want to miss that experience, and I think was looking forward to getting out there with a bit of independence and such. The university was really good, however, and has continued to be, just with their protocols around COVID. She's in a traditional dorm room, which ordinarily she'd be sharing a bathroom with the person in the room next door, but they've made them all completely single. So she has this really nice large bathroom to herself and her own room. They're not allowed to have any gatherings in common rooms or anything like that. They do eat at a dining hall. The tables are socially distanced and they wear masks, and she's really good and very much an advocate for continuing to keep COVID protocols in place. So it really hasn't been a worry in that regard. If anything, she worries a little bit because as happens, there are people who opt to disregard the protocols and party on campus. And that does make her nervous because she just wants to get what she can out of the university experience this year and be safe doing it. What made me feel really good as a parent is that I had mentioned a bit earlier on in the academic year if she would be interested in trying res again next year if things were back to some sort of normalcy and getting the typical first-year university residence experience. And she said, you know what? She said, I don't think my experience would be that much different because she did manage to make some friends through her classes virtually and through others in the residence, and had a group that she would go have breakfast with in the morning and such. So that made me feel really good that despite everything going on, she still found it a valuable experience this year.
I just have a question. So she actually experienced kids in her environment who were going against proper protocol?
There were a couple outbreaks on campus, smaller ones, which were reported, obviously, to those who were living on campus. And just, I guess, word of mouth or through social media or such, she would hear that there were people attending parties. Not necessarily on campus. I think most of they were all off campus, but it was students who were involved. So
So it's a bit concerning now with this new variant, that younger kids are now getting COVID quicker, and it's getting a little more severe for them. Does that concern any of you?
I'm hopeful that they'll soon be in line to get their first vaccination. So I think Michelle and I are both in the same region, and we seem to be moving pretty well along with the vaccination. So I'm hoping that their cohort will come up soon to be able to receive it, which will make me feel a little bit better to know that at least she's covered that way.
Yeah, and Vicki, you're way more optimistic than I am. One of the things that I've been really frustrated by is the lack of definition around this next phase, right? So I track the vaccine data like kind of a data crazy person, but the government hasn't even articulated what the kind of high risk group and their caregivers are. So that, we are, probably 6-8 weeks away from getting to the next level, which is 65 to 75-year-olds plus our children, right? So the way that it's defined right now, it says people with chronic illnesses, and their caregivers that put them at greater risk, but they're not saying who that is. So I'm quite alarmed, actually, that, we've had a 70%, I just ran the data, 70% increase in the percentage of patients in the hospital who are in the ICU. So hospitalization numbers have dropped from like a high of 1,700 on January 12th to, 685, 985 now, but there are 37% of the people, 1 in 3 is in the ICU. So these are young people. Old people don't go into the ICU. So I'm stirring the pot a bit with our government, and we have citizenship in another country, and I'm thinking about taking my daughter, there, because it's just anyway. Don't even get me started. But
I think Diabetes Canada worked a deal with the government that diabetes, youth with diabetes or anyone with diabetes is considered chronic. So perhaps you should just go online for Diabetes Canada and check out what they're doing and what agreement they made with the government.
Yeah, I've done all that. Anyway, it doesn't, they can make promises, but the government has not articulated that type 1 diabetics are in line for the vaccines at a certain point in time. So that's alarming.
Do you have a final message for any other parents that might be watching, or any your best piece of advice for parents of type 1 diabetic youth? We can start with Vicki.
I think just to reiterate what we've sort of said here, prepare your children to succeed, give them the confidence to be able to manage their diabetes on their own, but also be the support person and the resource that they always have in their back pocket when they need somebody.
Yeah, I agree with that. I'm in my mid-20s now, and I'm fully independent with my diabetes, but sometimes I still call my mom and say hey, can you do this for me? And she still does it for me. So it's good to have that. Michelle, one last message or piece of advice for parents.
Yeah, I just say be their coach, right? You're raising an adult, and you're not going to send them out on the field unless you've kind of prepared them and put them in the right equipment. So just never shame them and never blame them.
I think that's awesome advice. Thank you, Vicki and Michelle, for sharing your wonderful insights. And here's to all the parents who help their children spread their wings. It's not easy, but I know we all appreciate their support. And now, last but certainly not least, let's welcome our amazing alumni panelists. When I call your name, you can go ahead and introduce yourself, because we have so many wonderful alumni, we couldn't fit them all on one slide. So we'll start with Alex and Luka. So Alex, would you like to introduce yourself?
Sure. Yeah. So my name's Alex Bennett. I was a 2012 DHF recipient, and I went on to do my undergrad at Queen's, and then just recently graduated from my master's at U of T. So yeah, lots of experience going through lots of different transitions, but I guess I was also 16 when I was diagnosed, so that transition was a little different for me, where I kind of took a lot of ownership at the beginning, maybe not of prescriptions and whatnot, but a lot of ownership of managing from the start. So.
Okay, next, Luka, introduce yourself.
My name's Luka. I was a recipient in 2016, and I got diabetes in 2010 when I was only 11 or 12 years old. But since then, I've done my undergrad in biomedical sciences at the University of Ottawa, and now I'm in British Columbia doing a master's all about data science. So that's a bit about me. Is there anything I'm missing?
I don't know. What you said seemed pretty good.
Awesome. Okay, we'll go from there.
Okay, thanks, Luka. Next, we have Hala.
Hi, everyone. My name is Hala. I was diagnosed with type 1 diabetes at the age of 13. I'm currently studying right now health sciences. I'm in my third year at Ontario Tech University, and it's a pleasure to be here. I'm very happy to be able to speak in this webinar today and being a part of the Diabetes Hope Foundation. I'm currently a mentor and I enjoy volunteering, and this allows me to give back to this amazing organization. So thank you so much for.
Thank you, Hala. Next is Rajitha.
Hi, everyone. I was a diabetes scholarship recipient in 2019, and I was diagnosed with diabetes pretty young at the age of 4. So transition kind of came in bits and parts throughout my journey with diabetes, but I'm really excited to be part of this panelist and talk about experiences. I am currently in my second year studying business at York University, but on the Glendon campus, so I get a little bit aspect of bilingualism there, and really excited.
Thanks, Rajitha. And next and last, we have Simon.
Hi there, everybody. My name is Simon Taubman. As you can see on the screen there, I was a 2020 recipient of the scholarship from BMO Bank of Montreal. I was only diagnosed with type 1 diabetes back in 2018, so I've had it for going on 3 years now, but I want to do all I can to give back to the foundation and also to inform those around me with the knowledge that I have.
Thank you, Simon. Okay, we'll jump right into the first set of questions and themes, which I think is going to come from Rav.
Now, as we all know, diabetes is a 24/7 job. I like to joke that it's like a 25/8 job because it's just always there. And those who have it are the ones making the decisions. There's rarely a day off, and it's important to be as informed and prepared as possible. Now, if we add this to just everyday life and, you just sprinkle in a pandemic, yeah, it's a lot to manage. And, kudos to everyone who's trying their best. Folks living with diabetes make 180 decisions a day related to diabetes management. Now, all these decisions seem daunting, especially when we take the reins from our parents and become fully independent. So what was your journey like going from high school to university to beyond, if you did postgrad, and even from pediatric care to adult care? So we'll start with Alex.
Sure, yeah. No, I would say the transition from pediatric to adult felt a little jarring because I was at actually Markham Stouffville, and they had such a whole network of people that you'd come see, the dietitian, all the healthcare workers and everything. And then I transitioned into a clinic where I really just saw the endocrinologist, and I felt like I was missing all these other limbs and whatnot, but it was just, I needed to ask for more help, and they would provide it, but it was just, I guess it's more that self-advocacy, asking for, oh, I would like to speak to the dietitian, and it's not assumed that every time you come, you get to see them. And so I think that was one big step is, yeah, a bit of that self-advocacy when you're talking about your adult care, and ordering supplies going to university. I guess I was lucky because I had grandparents there, so my mom just shipped my my supplies to get ordered there. So I guess I was a little insulated in first year, but second year I started having to go to pharmacies and everything and get all my supplies. So,
Luka, how about you?
I just wanted to add on to what Alex said. Yeah, jumping from pediatric to adult was a bit of a shocker when you realize, oh my God, all of my nurse friends and dietitians are gone. It's just me and this endocrinologist who doesn't even know who I am, right? They didn't watch you grow up or anything like your pediatrician may have. So that was a bit of a shocker. but what was nice was that they were on my way to school, so I didn't really have to go out of my way to actually go see them. As for ordering supplies, that was a big one. I had no idea how insurance worked. I had no idea what my parents were doing. They helped me figure out this business, but I ended up switching from pump supplies to the pen because it gave more flexibility in terms of traveling and ordering, and you didn't have to like ration all these sites. You can just bring tips you need, bring the pen you need. It just seemed a lot more simple, but at first it was very daunting, and we can sort of get into the smaller advice as we keep discussing.
The waste that comes from, like pump supplies and like medications, I was so overwhelmed when I had to deal with that by myself. And that's just like the garbage aspect, not actually like managing it on my own. So I totally get that. How about you, Hala?
I think in general, it's pretty difficult to transition from high school to university. Sorry, there we go. My insulin pump. But, I think it's difficult in general, and then let alone living with diabetes. But I was very fortunate where I was able to I go to the Charles H. Vest Diabetes Center, so it's located right next to my university. It's about like a 5-minute drive, so I would commute anyways from Pickering to Oshawa to go to my university. And that was, I think, one of the bittersweet things. Like, it was one of the nicest things about my transition, because I developed a really good relationship with my pediatrician. She was there from the very beginning when I was diagnosed, and then to transition to adult care was very tough for me. And as the other speakers had mentioned, they weren't there from the beginning. And I just felt like I was just one of those other patients. Like, I didn't feel like it was like as kind of just like as personalized, but it's okay. But it's, it's getting there. I'm still adjusting. It takes me, just in general, it takes me more time to adjust to things, but that is okay. I also think that, something to talk about is the relationship you also have with your parents, because you're also becoming very independent. And I would, tell my mom, it's okay, I can book this appointment on my own. So I'm already pretty independent, but it's good to communicate with your parents. I got this, and, if I need help, I'll definitely reach out and ask you. So that was another thing, to book the appointments on my own before adult care, and then after when I did transition. So definitely still a learning process as I go.
100%. And I definitely empathize, telling your parents, like, it's okay, like, I can book appointments, like, it's like, I can do that. I started taking the reins of that when I was like 10. So, and I'm turning 26 tomorrow. So it's been like a 16-year long battle. My parents being like, you're sure? And I'm like, yes. How about you, Rajitha?
I would say transition is always difficult, but knowing where you're going to go, like before I transitioned into my adult care clinic, we did the research of like where we wanted it to be. Like, we wanted it close to our house, and like and we checked out the recommendations of the doctors and of the staff and like of the people, and that really kind of eased it a bit. So it wasn't so much of like, oh, this is a new building, this is a new environment. It was like, okay, I'm kind of familiar with seeing your name on the screen. I'm familiar with seeing these like similar addresses and names and stuff. And for me, I felt really happy with the place I got to now transition into. It's still kind of what I mentioned before. It was, I'm still building those personal relationships. They don't know me from day one, but they were really friendly and really opening. So it did help me to kind of start being more independent and start going into things on my own a little bit more.
Building that personal relationship with your endo is, I feel like it does take time. I was really lucky that my nurse from my pediatric clinic is the same nurse that I see. So like, we have like such a close relationship, and I'll see my endo, and it's just a little bit, a little more strange, but it is what it is. And lastly, Simon.
Yeah, I mean, a lot of it is just really echoing what everybody else has said about, building that interpersonal relationship with your adult care provider. It can definitely be daunting at first when you have to assume all of that responsibility. I myself, seeing as I've only had type 1 for going on maybe 2-3 years now, I had a lot of that responsibility from the beginning. So, it's like I was doing the ordering of prescriptions. I was doing the, like the administration of insulin and checking of lows and all of that kind of thing. And a lot of it is just difficult at first, but you ease into it, I find. And while it is, like I've said, and I hate to sound like a broken record, but it is daunting, it is overwhelming, it is difficult to manage at first, you get used to it. And again, echoing what everybody has said about having their adult providers kind of be welcoming and open to their concerns and their feedback even, it makes a huge difference in that transition, because if you feel comfortable where you are, that's what's most important, and it means that you can do the best job possible.
Yeah, and it's okay to admit that, you know, things are daunting, and if appointment after appointment is daunting, that's okay. And sometimes you just have to get comfortable being uncomfortable. And like you said, you eventually just get there.
Mm.
So next up, Clara.
Before I move on to the next question, just to add something to that is, I think it was Luka who said that you don't understand prescriptions and pharmacies and all that. I've been doing this on my own now for maybe 6 or 7 years, and I still don't understand prescriptions and pharmacies, or insurance companies as well. And I have a unique experience of recently moving provinces. And not for school, so that means I had to change my residence. And I actually am currently using an online pharmacy called Pocket Pills. And for anyone that is in sort of like a weird moving situation, online pharmacies are actually very cool and very useful. So if you want to know more about that, message me. But moving on to our next question, it's all about living on your own. So right now, some of us are living at home with our families. Some of us have moved across the country, or maybe just moved down the street, but are living on our own. Regardless of which camp that you fall into, what has your experience been like so far in terms of moving away from home? So this time we'll start with Hala.
I actually live at home before the pandemic happened, but what I do want to talk about is how important it is to be organized, because even if you do live at home, you can still have that independence. And I want to just emphasize this: no matter how much you try to plan when it comes to diabetes, things are not always going to go your way. It's actually funny. Like I think, with low blood sugars, the one time I don't have my juices when I go low. So I'm like, I don't even know why that happens. Yeah. That diabetes is very unpredictable, just like life. So I think that, being organized, being really realistic with yourself about your capabilities and your schedule with classes and things like that, you can really plan things around. And that was definitely one of the things that I did when I transitioned during my first year, and continue to do as I go on.
Thanks, Hala. I definitely feel you on the one time I never go low, but then whenever I don't have, and I have snacks in all of my pockets of every single coat and every single purse. And then the one time I go low is when I have like the one jacket that doesn't have anything in it, and I'm like nowhere near a convenience store. That's just how it goes. Simon, how about you?
Again, I'm at home as well. I haven't had to move out, but I think that if you are with roommates and you're in a dorm room, or perhaps you're in an apartment that you rented with them, it's definitely very important to make sure that they know. Because if they don't, and something goes wrong and something happens, they don't know how to help you. And from this point on, I would say that the best thing you can do is, if you decide to move in with a group of people, one, it takes some of the burden off of you, meaning that other people can also look out for you. And obviously, while you know your body the best and your symptoms and everything, if they can also detect it along with you, it might make it a bit easier. I would also say that the other thing is that it really helps if they are enthusiastic about learning about it. I've had friends of mine from my game dev program at Algonquin College. They are all moving in together, and they've tried to get me to go with them. And countless times they've said, "Oh, if you teach us about diabetes, we'll teach you about moving in and gaining some of that independence and freedom back." And it's like, guys, I can't do it right now, but I appreciate the thought. So definitely find yourself a good group if you're going to move in with people, but also inform them, give them like the binder you got when you were first diagnosed with all the information, all the things like that. Small things that you can do to help them would make, I guess, the best difference possible. Yeah.
Yeah, I definitely echo the whole surrounding yourself with good people. If you're ever moving in with someone or becoming friends with someone or maybe even getting in a relationship with someone and they don't seem to really care or take an interest, that's sort of a red flag. And I guarantee that there are better friends or roommates out there that do actually care about your well-being and want to know about it. I have a friend that will carry around a can of pop when we go on walks. And I always tell her, I'm like, there's lighter kinds of candy out there. And she's like, no, I read online that pop is really good for lows. I'm like, that is true. So that's the kind of friend you want in your life, or roommate. Alex, what is your current living situation and what sort of advice do you have about it?
Yeah, so I guess the pandemic has tossed some things, and I've actually moved home with my parents. But I guess over the last 6-7 years, like I've been going from res to living with roommates and whatnot. So what I would say is just, be open and communicate with them. Like I guess I was lucky in first year I moved in with my roommate who was from high school, so they knew about my diabetes. But I think I found that I just had friends that were just very curious. So we'd be eating in the cafe and they'd ask questions, and it's just be open to answering them, because some people, like, it's not something you need to hide or anything like that. And I found that there was always one or two people that took extra interest, and then whenever we're going somewhere, they would make sure to kind of like check in and whatnot. So I think it's just surrounding yourself by like good people, and they will make that transition better, because you're kind of recreating that kind of home network away from home.
I think that's a good way of putting that, home network away from home. Luka, how about you?
I actually moved out last year, but I stayed at home for undergrad. So I didn't really, the whole moving out part was not really overlapping with the whole transitioning, getting comfortable part, which is, I can't even imagine how stressful that is if you have to do both at the same time. Because I remember moving out, everything was just happening so fast. No one knows what's going on. And you really need to like set aside some time and like put diabetes as its own category in terms of things you need to supply, or like what pharmacies are close to where I'm going to live. I can just call and transfer my prescription. What was nice this year though was like phone appointments with your endocrinologist, right? I didn't have to go looking for a new doctor when I can just call mine or have like email my nurse and be in touch with them really quickly. So that was really nice. In terms of the whole blood sugar management while living away, pretty much the same as you guys. I keep fruit bars literally in every jacket, every pocket of my bags. And if you think you don't have enough snacks, you probably don't. So don't ever hesitate to overbuy snacks and sugar, because eventually you're just gonna use it all. Right? Save yourself some time and just go all in that aspect. What else? I feel like what's really overlooked is actually the stress for parents, especially if parents have ever had to deal with their child going unconscious from hypoglycemia. Moving out could be a really big deal for them, because they're still living with that experience, while it's like you're unconscious, you don't remember anything. So that's something you have to address, and you should always like be communicating with them, just to kind of reassure them that things are going well. Or if you have a way to connect your diabetes data with them, that's also something that we've managed to do, and it brings a lot of peace of mind to my family. And I think the last one was roommates. Yeah, I have one roommate. Talk to them. Yeah, like everyone else said, talk to them about your condition, or even like show them where you keep your glucagon, how to use it. So if anything happens, not that they should or that they have ever happened, but what's possible, what can happen, can happen. So show your roommates what they can do and how to deal with these situations if they ever do come up. But yeah, so far so good. I'm happy.
That's great to hear, Luka. And then Rajitha.
Yeah, I'll just add on to what everybody else was saying. I've been living at home even before the pandemic, so I always had that support a little bit closer by. But I would say that some things that did change was having more conversations on my own about talking about diabetes, or talking to my teachers or to the accessibility services on campus. I remember when I was younger, like I always had a parent with me talking about my diabetes for me, and like just saying like, okay, so here's my daughter, this is how it's gonna go. But now I had to have that conversation, so it was like I was defining that, And it's a little bit different when you are starting in a new environment. Like university is not an environment that you grew up in. You're kind of entering there for the first day and then you're having all these new conversations. Managing my blood sugar, I would also agree with Luka, sharing your diabetes, like your blood sugars with somebody if you have that ability to. It does help, especially at night or sometimes when you're just unaware of things and they can keep an eye on it. Yeah, and just talking to people around you, and you kind of make friends who are diabetics, or you find other diabetics on campus. And most of the times I think they're really eager to meet another diabetic and have that conversation and continue that. So it's good to just be a self-advocate and continue that conversation anyway.
Thanks, Rajitha.
I'm just going to quickly add on one point. So I transferred from the University of Ottawa to Ryerson, and so that's in Toronto. I live in Burlington, so I took the train whenever I had to go to school, so it's an hour long. So if you are commuting, please just bring snacks. There have been a few times where I've gone low and I have nothing on me, so I'll text whoever's picking me up and I'm like, bring everything you have, because that's the only thing I can do, so I can't stress that enough. So next we're going to talk about nutrition and physical activity. With most of us working from home and or attending lectures online, it's so important to get our bodies moving and making sure that we're indulging responsibly. So just being a little bit mindful of the time. How have you kept up with nutrition and physical activity? Let's start with Hala.
I'm still actually working on this. The problem with me is I kind of lose track of time when you're in an online lecture. Again, nobody is telling you, hey, take a break. But I would notice like my blood sugar would go high from being sedentary, and I'm like, oh my goodness, I need to go take a walk. So I would actually take a walk around my neighborhood, and then I would have my lunch, and then my blood sugar would be good, and I would be relaxed. I would feel pretty good getting that exercise in. In terms of nutrition, even though we can eat everything that we want and just need to give the correct amount of insulin for it, I do strongly think that eating a well-balanced, healthy diet plays a huge role in maintaining your blood sugars to be very in range. And for me, I get really bad headaches when it goes up and down, and I get angry, and I'm like, oh my God, so, eating well and having good amounts of exercise. It doesn't have to be like 2 hours, but just 30 minutes can make a big difference. And having a CGM, I think is crucial. I don't know how I would manage my diabetes without my CGM, the continuous glucose monitoring. And it just gives me peace of mind, whenever, I could just bring my phone, and then I have my PDM for my Omnipod, and then just some Dex for the tablets, and then I would go for my jog and then come back, and being alerted when you're going low, like the downward trend is really nice. So sometimes I don't feel that, and again, my mind is busy, or there's just so many things on your mind. So I think that is really nice to have. If let's say a student that's transitioning doesn't have a CGM, I would highly recommend looking into that. And yeah, there's so many different brands and all that. So maybe, looking online and just seeing different reviews and things like that, it would be a great way to start looking into that. But it has made a really big difference in my diabetes management.
It's so important to just do the research for yourself, and it does take trial and error, and that's okay, because diabetes management looks different for everybody. How about you, Simon?
I myself need to improve on the whole getting active bit, because I find that a lot of the time, just with the sheer amount of work that I have to do and the length of my classes as well, I find that I'm often sitting at my desk, as I am right now, and I don't get to go on walks like I usually would, or I don't get to walk around campus either, right? So I notice that there are fluctuations in terms of blood sugar there. But I would just say that even if you set aside like 30 minutes, maybe an hour a day just to walk around and like get outside and enjoy some of the lovely weather we've had lately, it makes all the difference. And then in terms of just eating well and managing, I guess, your diet and such, it's just like everybody said, you can eat what you like, but just remember that moderation is the key, because you don't want to go overboard, and you certainly don't want to go underboard, which I guess is a word now. But just find that perfect balance, so to speak. And you know, if you wind up going high one day or you wind up going low another, just make note of it and adjust as necessary, because, you know, as it says on the slideshow, it is trial and error until you find that balance. And that is the struggle that I'm sure everybody here has faced many a time over and over. But despite that frustration, despite the sense of impossibility at times, it does become easier. It's just about, you know, balancing everything that we've talked about here to make it easier.
How about you, Rajitha?
It is important to eat healthy and take an active role in that. And I think as we get older and more independent in our diabetes, we start to notice like we're making these decisions for ourselves and for our own body, and we're taking that action. So whatever we do is reflected in like our blood sugars or in our health and in our long-term health and mental health. That it's always important to have an active role, and physical activity and taking that small walk kind of just helps balance things out and gives you a fresher for the day, besides like what we're doing right now, talking about it. And similar to what was said before, a lot of my classes I have to sit down at a desk, and I'm sometimes like constantly looking at my blood sugar with my CGM and thinking like, okay, it's 11 right now. Maybe I can just go for a walk, and I can take that as a break and my excuse, and I can just put that day like in a happy mood again, besides sitting in front of my lectures and in front of a screen. But it's really important to take that time and find what works for you. It could be anything, really.
Yeah, I always try to like a little walk or a little moment on the treadmill is like my me time. I put in my tunes and I can just walk everything out. Fantastic. How about you, Alex?
Yeah, I guess one thing I want to touch on is moving out on your own. One of the harder things was, I guess, cooking and like food and trying to figure out the best balance there, because in first year you have like res and food that's giving you there, and that helps ease the transition sometimes, but actually having full control of what you're eating and selecting is super powerful and allows you to really manage your diabetes better, I found, because I had friends that would like to eat out a lot and everything, and like it's fun to do that occasionally, but I also found like you can have a lot of fun with cooking yourself, and you can make it easier on yourself managing that diabetes. So that's definitely a big thing about moving out on your own.
And lastly, Luka.
I agree with Alex. The pressure to eat out is real, and it's not good. It's not good for the sugar, not one bit. But I found it really frustrating undergrad, because your routine just becomes like a mess for 4 years, and that becomes really hard to find a regular time to exercise and eat. Fortunately, I didn't have to cook all the time, but now I do cook. So making sure you have, you don't need recipes, just try like mixing things together. But eventually when you find something that works, remember it, like write it down or something. I find chili is awesome. Chili does not spike my blood sugar. It has a lot of protein. So if you're an athlete, that's really good. That's really good for recovery. And not to mention that sort of blood sugar stability that comes after really strenuous or good exercise. I mean, it doesn't have to be strenuous. If you exercise enough, you might see stable blood sugars come overnight or the next day, and that's a huge advantage of exercising. So definitely prioritize exercise, even if you have to like stop studying for like 2 hours. The amount of stress that it will relieve from you to be able to go out and break a sweat is huge. That's amazing. Also, like, yeah, if you don't cook and you're just eating things like ramen, try to at least like maybe add like an egg to it or something to sort of lessen the impact of that glycemic index. Because as many of you know, these like blood sugar ratios, or sorry, insulin ratios aren't always perfect. They change based on your stress levels. They change based on what proportion of your diet is fat and protein. They change on how much you exercise. They even change if you take something like a magnesium supplement, which I find like it's good for like relaxing muscles if you're sore, but also it causes your blood sugar to drop a lot. So take note, even if supplements that you're taking, everything has an effect, but eventually, I think we all figure these things out. So take mental notes or paper notes, whatever works for you.
Yeah, that's like me. I'm vegetarian, so I take B12 sometimes, and they're always like cherry flavored, and I'm like, oh, it tastes great, and I check my blood, I'm like, never mind. Next.
Okay, so the last sort of theme of questions we're going to go over all has to do with night out. So it's like the fun question. So our social lives, they look very different right now, so, you know, with everything being online, Zoom parties or park hangouts and whatnot, but warmer weather is around the corner, vaccines are coming out, and we might be returning to some form of normal soon. And so thinking about normal, using air quotes here, normal socializing where we're actually like out with friends, maybe at a bar, maybe at a restaurant, something like that. What is your number one tip about managing your diabetes on a night out? So if you had to tell a new diabetic that was going out for the first time one thing, what would you tell them? And we'll start with Alex.
Bring snacks and lots of them. I feel like that's, we've said that throughout, but I think that's one of the things that it just being prepared in that sense, and like maybe having like a go kit where you have your testers and snacks and whatnot, but also being open with the friends you're going out with, because they might change night to night, and like always have maybe one or two people that know you a bit better and know about your diabetes. So
Hala, what is your number one tip for going on a night out on the town with diabetes?
I would say just being very open that you're living with diabetes. So don't be shy. Don't be shy to test in front of people, or if you're taking injections, don't feel that you have to go to the washroom and then do it privately and then go back. Like it's all in your comfort zone, you know, and who's around you. And for me, if I'm not comfortable with who's around me, I don't even want to go out personally. So let alone if you're living with diabetes, I would just personally, you know, just again, be very open. This is what I live with. This is what I have to do. If this happens, this is what I need you to do to help me. So that communication is very important in my opinion.
Yeah, that's a good point. And on a note about being open and like, you know, not thinking you have to go to the bathroom, I've become the master of injecting insulin at 2 o'clock in the morning on a moving subway. So it's a very good skill. Luka, how about you?
Oh, well, lots of things, but if I can sum it down to two things, one is know your intoxicants. As a scientist, I love to, you know, experiment, not like when you're going out, but know how alcohol affects your blood sugar. You personally, obviously they're general trends, but for yourself, know what you have to do. Know how marijuana might do that. These are all things that you'll encounter when you're going out. I know, at least for me, alcohol will like lower my blood sugar later in the night. So maybe give less basil, or maybe like everyone else said, bring snacks. You definitely want to have those if you're not close to home. Marijuana, on the other hand, makes you forgetful and complacent. So it's really easy to forget to bolus or forget to carb count. Maybe you just don't want to carb count when you're in that state. But just being aware of these things really helps with management. And another thing is getting a continuous monitoring device for your glucose is super helpful. And it sort of lets you still manage your blood sugar while keeping it sort of in the background. It's very convenient to just take your phone, scan your arm, or look at your pump and know what's going on. You don't have to like stop and prick your finger. And obviously, if your insurance lets you do this, take advantage of it. It's super useful. Anything else? Oh yeah, Claire, I'm with you with the whole sport competitive injecting in situations they're not ideal. Like, yeah, I don't know.
I've injected in many strange places before. But yeah, thank you for being open about that, Luka. Like, just as a note, like you may have an endo that tells you to, you know, you're a diabetic, you can't drink or whatever, but I think that's poor messaging, because like we all know that young kids might try drinking or smoking or something like that, and it's good to just do it in a place where people know, like what Hala said, like make sure you're open about it or whatever, and like just try it in moderation, and just know how it affects your body and whatnot, and don't feel any shame around it, even if your endo is being like, you can't do this. Like you can do it. There are safe ways to do these things. Rajitha, how about you? Number one tip for night out on the town, whether that includes alcohol or not.
I would say just plan for the situation. Like what people said, bring snacks, know your surroundings, know if you're comfortable with certain, I guess, situations or topics that are going to come up, and don't be shy with it. It might be kind of awkward with your diabetes at first to like present it all at once, but if you need to, you kind of need to, and you need to take care of yourself first, especially a night out with your friends, because you want to have that open conversation from day one.
Thank you, Rajitha. And Simon, how about you?
Sure. I think that the main thing, while also echoing what everybody else has said, the big thing is just use your common sense. Like that's the center point there for a reason. And it's ultimately just because you know your limit. Like if you're out and you're having drinks with friends or whatever, don't go over that limit because it's going to be terrible. It could go very, very wrong. Same with if you smoke or partake in activities related to the consumption of marijuana, right? Like know your limit, do not go over it because it could end very badly. And if it does happen that, you know, something does happen, I would say make sure you're with people that know about your diagnosis, that know about your condition, or, you know, you could be with roommates as well, right? Make sure that they know. Like I would even say if you're going to a party with people, tell the host, hey, this is a condition I have. Just if you could keep an eye on me, that'd be great. But I thought, like I know I myself speak from experience because while I myself do not drink or partake in those activities, I have friends that do. I have a few friends who are type 1 diabetic who do all that kind of stuff, and I do my best to keep an eye on them because, you know, one, who else is going to do it, and two, it's a lot of fun just to make sure that they're staying safe and that they're having fun while you're also having fun. So just look out for people as well, right? Because if you see that something is wrong, intervene, step in, say, hey, maybe you should check, maybe you should make sure that you're doing okay, you know, maybe eat something, stuff like that. Just use your common sense, know when to quit, and be there, be vigilant, because somebody who is not able to tell those things might need you to tell them for them.
That's great advice, Simon. And I think, like, diabetic or not, just, you know, look out. I look out for other people. I've been the caregiver for my friends who aren't diabetic when they're going out. You know, I think that's just good advice for anyone, for young people living on their own, is just look out for your friends, step in when you think something is wrong, or some, you know, someone might not be safe, whether that's, you know, physically or related to their health or something like that. So it's universal advice. So thank you, everyone, for being so open about that last question. And thank you for all of your answers throughout this panel. It's every time I've sat in on one of these panels with other diabetics, I feel so happy after, because I'm like, oh my God, they get it. There's other people that get what I'm going through, all these like funny little quirks about being a diabetic. It's like, oh, I'm not alone in this situation. So I love being on these panels because it just makes me feel not alone. Thank you.
And just going to reiterate one last point. Please be with people who get it. It requires an uncomfortable conversation and they don't understand, get out of here. If they are your friends and they're in your corner, stick with them. I recall one time at a party, I had not even too much alcohol, I had too much sugar, and I just needed to like sit down, and people were heckling me to like partake in party more. And my best friend was like, no, and like she like stood in front of me and like defended off this crowd of people. And her name is Tori, so find yourself a Tori is my message.
Thanks, Rav. We're on the last 5 minutes or so. So Barb, if you're there, maybe you can talk a little bit about Nothing Can Stop Me.
Wow, you guys are absolutely amazing. It just blows my mind how rich your experience is and how articulate you are. And I'm sure there are some amazing takeaways from what all the information and advice that you gave our audience. I'm so proud of all of you, and I thank you from the bottom of my heart for sharing your stories and for really enabling our guests out there to really benefit from all of your information. So I thank you very, very much. So this is a nice little gold nugget we created. Actually, it was my younger son Bobby. he wrote a story when he was in grade 5 or 4 on foolscap. It was a school project. And 23 years later, I found in the bottom of my drawer this kind of really wrinkled up combination of papers stapled together. And I thought, wow, this would be a great book to publish, self-publish. It's called Nothing Can Stop Me, and it's really about a young boy, Matt, who was a hockey player, as Bobby was a hockey player as well. And just, how just a day before his championship game, he ended up in the hospital, and he didn't know if he could ever play hockey again, and it ended up that he did play hockey. It's a true story. And so I thought, what a great messaging for young kids who are just recently diagnosed, that you can really do anything. Once you have diabetes, it doesn't stop you from being anything or doing anything. So we printed this book. We had 2 of our alumni, one of them edited and the other one illustrated it. And it's just a wonderful book, and we're very proud of it. We sell it, it's $19.99, and all the proceeds go to a scholarship. So just wanted to share this with you, and it's online.
VHF is launching a new initiative called Transition in the Kitchen, which is a flexible recipe guide to help youth transitioning from high school to post-secondary to get more comfortable and confident in the kitchen, echoing Alex's statements earlier. So this piece will be an addendum to our current transition guide and will be updated later this year. The recipes are easy, delicious, and healthy, and they can be adapted for special and restrictive diets. So if you're carb conscious, gluten-free, plant-based, vegetarian, we have you covered.
I just wanted to add to Rav, we've been doing so many webinars, and our takeaway was many of the kids who were, who were in the pandemic and who were just bored, decided to take up cooking. So we decided that it would be a great idea to create these recipes for kids who are just starting out on their own, to get used to the kitchen, to get used to food, especially for dietary restrictions. And so we had, again, our alumni coming on board. Rav did a questionnaire, and Deborah Sloan is heading up the program, and Rajitha is part of it. We Clara as well. So we have some wonderful participants in the alumni circle, and we're putting this together, and it should be completed by the end of August, I believe. It's not going to be a cookbook. We're just starting it as a transition addendum. So it will be online for everyone to share. We're celebrating our 24th annual Swing of Hope, June 21st at Ravjot Golf and Country Club. So any of our audience out there who are avid golfers, please join us. All proceeds go to the foundation, and it'll be a different kind of golf agenda. Every 15-20 minutes you'll be teeing off, so more information will be online.
Yeah. So thank you to all of our speakers today. It's such a pleasure connecting with you and hearing all of your stories, tips, and tricks. We appreciate your continuous support and paying it forward, which is like our mantra here at DHS. And as we wrap up for the day, we urge everyone to go online to the DHS website and look at our transition resources guide, which again features all types of diabetes support programs across all accredited Canadian colleges and universities. I've included the link in the Zoom chat and on our Facebook chat. For those of you watching today, we would like to extend an invitation to join the DHS mentorship program, where we will match you with a mentor from the DHS family. The mentorship program is designed to help support you through this very stressful time. So visit DHS website for more details on how to join the mentorship program.
If you have any comments, please feel free to email us at info@diabeteshopefoundation.com. It's also up on the slide right now. We hope this webinar was helpful to those watching. I know it was helpful to me, and I'm not even transitioning. It's like I said, I always learn so much from these panels, and even if it's just camaraderie and solidarity. So we hope that you took some positive takeaways from it. So thank you for watching. Have a great day and stay safe.
Bye, everyone.
Thank you all. Stay safe.